The digestive system, the opening slide here is simple columnar epithelium. So simple means one layer thin, and these are all shaped like a column, and this is what lines the majority of our digestive system. Okay, most of the nutrients that we eat cannot be used in the form found in our food unless they are broken down into smaller components. Okay, so fat is broken down into triglycerides, carbohydrates into monosaccharides, and protein into individual amino acids. Okay, so those are the macronutrients: carbohydrates, fats, and proteins. And digestion actually starts in the mouth. Okay, so chew your food completely, and that's mechanical breakdown. So chewing is mechanical breakdown, and there are digestive enzymes in the saliva, so that's your chemical breakdown. So a big part of my practice is nutrition and digestive health. So this is actually one of my favorite sections because I practice this clinically. And one of the things we start with coaching people is it's of what you eat and how you eat. Okay, of what you eat and how you eat. So you want your food to actually be whole food and natural foods. Okay, so staying away from artificial foods, synthetics, lab created, man made chemicals, food coloring and your dyes, additives and preservatives. Okay, you want to stay away from that stuff because it is foreign to the human body. The chemistry inside of your body that is designed to break down food, real food, doesn't like all that artificial stuff. So that creates inflammation. Okay, so that's one of the things that we work on with my patients is of what you eat and how you eat. Okay, gastroenterology is essentially the study of the GI system. Okay, the gastrointestinal system. All right, here's some gross anatomy of the digestive system. So it's basically one long tube from beginning to end. Okay, so the tube starts in the mouth, and then you have the food tube, which is the esophagus, and then that goes into the stomach, which goes into the three parts of the small intestine that eventually gets into the large intestine. All right, so it's just one long tube from beginning to end. And then there are accessory organs that accompany the digestive system. Okay, things like the teeth, tongue, saliva glands, liver, gallbladder, and pancreas, and all the digestive juices that the pancreas releases. And the liver does there's a lot of functions within the liver and gallbladder that help with, that are accessories to helping us break down our food. Okay, inside of the mouth, you do have the teeth, which are part of the mechanical breakdown of food. The tongue, which is a muscle, is going to help you move the food around and help you with the swallowing action. We have our glands, okay, so the sublingual gland, so sublingual, so sub is underneath, lingual is tongue. So this is a gland located underneath the tongue. The jawbone is the mandible, so submandibular gland. You find a gland in the mandible area. There's also the parotid gland, and these release the saliva and digestive enzymes into the oral cavity to help you with that chemical breakdown. Okay, so an example is amylase. All right, when you see the prefix ase, or excuse me, the suffix ase, that means enzyme. So anything with ase on it is letting you know that that is an enzyme. And the job of an enzyme is to speed up a reaction. Okay, so amylase helps you break down your starches, which are basically plants, which are basically carbs. Okay, so that is what that enzyme is going to help you. All right, as food enters into the stomach is going to continue the chemical and mechanical breakdown. Okay, we'll talk about that later. All right, here's the gallbladder, the liver. Okay, the three different parts of the small intestine, which we'll look at later. And then we have the colon. All right, the appendix, cecum area. Okay, food goes up, or the waste at this point goes up. So this is the ascending colon as a result. Transverse colon, because it's found in the transverse plane. Now we've got the downward part, so descending colon. And this is following the direction of the waste that you will eventually expel. All right, then we have the sigmoid colon, shaped like the Greek sigma, so that's where it gets sigmoid from. And then the rectum, and then the anus. Okay, so that is all part of the large intestine. All right, the tubes that are inside of us pretty much follow the same model that we're going to go over. So starting with the inside most, that is the lumen. So anytime you're looking down the barrel of a tube, the hollow tube, that is the lumen. And that is going to have a mucosal layer. So it's very important to have that mucus to protect the tissue. Okay, the mucus is made from goblet cells. All right, the next layer out is the submucosa. Okay, this is where you're going to find, if you zoom in close to this, you'll see that there's a lot of cells. Okay, so blood vessels, arteries, and veins are going to be found in that submucosal area. And then you've got a muscle layer. Okay, so the muscularis, and it is smooth muscle. Okay, remember the three types of muscles that we have: skeletal muscle, cardiac muscle, and smooth muscle. Smooth muscle is essentially all the tubes inside of the body. Okay, and then you have the outside serosal layer that acts like a protective layer. As an analogy, it'd be like putting on a leather jacket. The jacket is a part of you. It's the outsidemost layer, and it is thick and protective. All right, there's a technique out there, or a practice called neuroendocrine. And this is an area that I specialize in. So if you think about the word neuro and endocrine, this is letting you know that the nervous system and the hormone system are intimately connected, and our digestive system is highly innervated by nerve and hormones. Okay, so there's a nerve network called the enteric plexus that regulates the digestive tract, secretion, and blood flow. Very important. So this is part of our autonomic nervous system. And then more specifically, you want to be in parasympathetics. Okay, we talked about that on a prior lecture. Parasympathetics is your rest and digest nervous system. Okay, the opposite of that is sympathetics, and that is your fight or flight. Okay, so when you're eating, you want to be relaxed. You want to be in parasympathetics. Okay, and as a reminder, the neurotransmitter is acetylcholine. That's what lets your body know that you're in parasympathetics. If you are in sympathetics, that is epinephrine, norepinephrine. And if those are being released, it basically shuts down the digestive system. So people don't digest very well when stressed or in sympathetics. Okay, another one with mood and appetite and the feeling of fullness and hunger. All that is hormone driven. So there's your endocrine part. In fact, the gut is now being called the second brain because there are so many nerves and so many neurotransmitters that the gut has. Okay, so what you put in your body is going to dictate your mental health, your sleep-wake cycles, memory, how well you function throughout the day. So you put good stuff in, and your neuroendocrine will thank you. You put pro-inflammatory chemicals in your body. So there's your artificial foods and additives and preservatives and food coloring, so the dyes and all that. Then you're going to create inflammation to the neuroendocrine system. Some gross anatomy continued. So here, there's your liver, gallbladder, that bile is stored in. All right, the greater omentum is like this apron that holds all these tubes in place. If you have a greater omentum, so we're following our anatomy rules here, if they give you a directional term or a size, that means you have the other one. So if you have a greater omentum, then you have a lesser omentum that helps keep things in place. All right, they took the greater omentum and reflected it back or retracted it. And you have a pretty good view of the transverse colon because it's in the transverse plane. Here's the descending colon because it's going down. And what we mean by going down is that's the direction of waste. It's going, in this case, it's going down. Eventually will exit through the rectum. All right, here's some examples of these hormones. So going back to that neuroendocrine, gastrin is one example. Okay, gastrin, which is a peptide hormone, is produced in the stomach. Okay, there are stomach cells called G cells that make and release this gastrin. And gastrin's job is to make hydrochloric acid, so HCl, be released. All right, hydrochloric acid is released. Now, hydrochloric acid comes from the parietal cells in the stomach. Okay, the parietal cells release hydrochloric acid and intrinsic factor. And intrinsic factor's job is to bind to B12 and help methylate it to carry it throughout the body so that our body can utilize that B12. Okay, secretin's function is to regulate the gastric acid. Okay, it also helps stimulate the pancreas to release bicarbonates to neutralize the acid. Okay, then there are histamines and prostaglandins. Now, these have the potential to create inflammation. Now, this does get a little weird, and at this level, we're not going to get too deep with this stuff. But the quick version is histamines and prostaglandins are important for digestive function. However, if a person consumes a food that they're sensitive to, then you're going to get hypersecretion of histamines and prostaglandins. So this is where you can get a runny nose, postnasal drip, your throat, saliva stuff can change, upset stomach. There's different so-called allergic reactions that can take place if there's too much of the histamine and prostaglandin released. Now, one of the things that I do in my clinic is food allergy testing. It tests 5 different layers to your immune system. It's the best test on the market. Really good. It lets people know what foods they are sensitive or allergic to. And then once the results come in, we go over these are the foods that are hurting you, creating inflammation and all these other digestive problems that you're having and these other signs and symptoms. And then these are the foods that your body is handling just fine. So now we know what foods to take them off of and what foods they can have. All right, the anatomy of the mouth. So we have our teeth, and they are broken down into the incisors and then premolars and molars. Incisors are designed to bite and tear. And then once you get into the flatter surface tooth, so the premolars and molars, those are designed to crush the food. And part of the coaching with eating is, since digestion starts in the mouth, smaller bites, chew your food completely. Okay, the uvula is this little piece that hangs down. When stimulated, it does cover the nasopharynx area so you don't get food and fluid up into the nose. If you lift your tongue up, you'll see this type of skin that is called a frenulum. And sometimes when babies are born, the frenulum is too aggressive, so they can't move their tongue. And then that creates a problem with breastfeeding. So an evaluation is done, and it just requires a little snip, and then the baby will get their tongue function back. Okay, there are holes underneath the tongue. Okay, these are passageways for the saliva ducts. Okay, the sublingual and submandibular. And so the saliva is released to help us with the breakdown of food to keep the mouth moist. Okay, the hard palate is immediately behind the teeth, and as you work posterior, it turns to the soft palate. Okay, there is also a frenulum on the lips. So you have a superior labial frenulum and an inferior labial frenulum. So if you grab your lower lip and pull it down, you'll see this little strip of skin. That's a frenulum. Okay, that you'll notice. The tongue does have taste buds on it, And depending on the shape and size, they have different names. So there's a fungiform papillae. That's a fancy way of saying taste bud. Then there's the foliate papillae and the valate papilla. So there's about 10,000 or so that cover the tongue and the cheek in the body, or on the tongue. This is what gives us our taste, right? So it's a chemical interaction. And once we put food, which is a form of chemistry, in the mouth, then you interpret that chemistry as taste. The fancy word for chewing is mastication. This is what breaks food into pieces small enough to be able to swallow, the first step in mechanical digestion. Okay, saliva moistens and cleanses the mouth and helps inhibit bacterial growth. One of the ways that you can actually help this is by lowering your sugar levels. Okay, so the more sugar that you consume, the more sugar actually suppresses the immune system and allows candida and bacteria and other things to flourish. When you start chewing your food and you break it down and then you begin the swallowing process, the food is now a bolus. Okay, so that bolus will then go into the esophagus and then eventually enter into the stomach. All right, there's also, or earlier we talked about the amylase, and then here's the lingual lipase. Lipo or lipid is fat. ACE lets you know that it is an enzyme. And if ACE is attached to the word lipo, then it's going to begin fat digestion in the mouth. Okay, the saliva is mainly controlled by the parasympathetic nerve fibers. And if you get stressed, a person can actually get cotton mouth, right? So the sympathetics can start to take away the saliva. So, you may get cotton mouth if you're stressed. But when you're eating, you want to be in parasympathetics, which helps to release that saliva. Okay, the esophagus has the upper esophageal sphincter. Okay, go back to your anatomy rules. If they give you upper, that means you have a lower. So the lower esophageal sphincter, and you have the upper esophageal sphincter. Okay, sphincters, the lower esophageal sphincter is also known as the cardiac sphincter. And this lower esophageal sphincter usually prevents stomach contents from regurgitating up and into the esophagus. If that happens, you do get this feeling of heartburn. I mean, it's not really that your heart is burning, it's just the feeling you get, and it happens to be in the chest, so they call it heartburn. Of swallowing is functioned by cranial nerve 5, 7, 9, and 10. And cranial nerve 5 is also known as the trigeminal nerve, cranial nerve 7, facial nerve, cranial nerve 9, glossopharyngeal, and cranial nerve 12 is the hypoglossal. Okay, you can see the bolus here, so chewing the food, and with help from the tongue muscle and other swelling muscles, the epiglottis will close off and cover the trachea so that this food is routed nice and posterior into the esophagus. Okay, as you can see here, the bolus is entering into the esophagus. Okay, there's a peristaltic wave. So this smooth muscle has this peristalsis or peristaltic wave. Okay, so the muscle does contract and squeeze as it propels the food inferior, okay, so toward the stomach. The lower esophageal sphincter will relax, allowing that bolus to enter into the stomach. Okay, gross anatomy of the stomach. As food is coming through the esophagus, it'll eventually enter into the stomach. Okay, so here is what they consider the cardiac part of the stomach. So therefore, that area has that cardiac sphincter, also known as the lower esophageal sphincter. Okay, we have the lesser curvature. If you have a lesser, then you have to have a greater. Okay, so this would be the greater curvature. There are three different muscle layers: the oblique muscle, the circular muscle, and longitudinal. Okay, those are in no particular order, but those are the three muscle layers. All right, the gastric rugae, so these little folds that you see inside the stomach, those are called the rugae. And very important structure, the pyloric sphincter. Okay, so that is known as the gatekeeper of what is now called chyme. All right, so we had a bolus, right? So the bolus entered into the stomach, and then the stomach is going to behave like a blender. Okay, so we're going to put an apple and chicken and all this stuff in the blender. We're just going to turn it on, and it's going to liquefy the food. Okay, so that's what the stomach does. And when that happens through chemical and mechanical digestion, now you've got this so-called liquid, kind of like what a blender would do, but its official term is called chyme. Okay, so it goes from a bolus to chyme, and the pyloric sphincter will relax in strategic intervals. Okay, so it relaxes from time to time to allow a little bit of the bolus to enter in to the first part of the small intestine called the duodenum. Okay, so it's duodenum, jejunum with a J, jejunum, and ileum. All right, so the first part, the duodenum, is where the chyme will enter. Okay, this top part is the fundus of the stomach, and then the rest of it is the body. Okay, getting into the microscope anatomy of the GI system, we get into, first of all, you can see all these folds. Okay, and then what that helps do is increase surface area within the stomach. Okay, and here's our gastric pits, mucosal cells. Okay, there's the parietal cells that release hydrochloric acid and intrinsic factor, the G cells that release the gastrin. Okay, a closer look at the parietal cells and the G cells. All right, you also see in the chief cells here, the chief cells are a really cool structure. They secrete pepsinogen, and pepsinogen is converted into pepsin, and pepsin breaks down proteins. Okay, now keep in mind the proteins you want to eventually be broken down into the amino acids. Okay, so unfortunately, when people have stomach inflammation because of stress or eating foods that are pro-inflammatory, then this process slows down, and incomplete breakdown of protein then enters into the small intestine and activates an immune response. And people can, their skin can break out, and all sorts of other gastrointestinal disturbances can occur. Earlier, I mentioned that the digestive system is under the neuroendocrine. Well, we have these enteroendocrine cells, and the word itself should give it away that there are a lot of hormones that are secreted, and that helps us with appetite, it helps us with mood, the feeling of hunger, the feeling of fullness, and on it goes. In fact, the direction the stomach goes is the direction the brain is going to go. It's why they call it the second brain. If pro-inflammatory things get into the stomach, then it's going to inflame the brain. If healthy things get into the stomach, then it will be healthy for the brain. Okay, hydrochloric acid, which is a very important structure or chemical that's released from the parietal cells. Now, keep in mind on the pH scale, 0 is very acidic, right? All the way up to 14, which is very alkaline. Hydrochloric acid is almost 0. Okay, it's very acidic. And the reason why it doesn't hurt the stomach is because of that mucosal lining that we have. Now, if you take NSAIDs, non-steroidal anti-inflammatory drugs like ibuprofen, it does decrease the mucosal lining in the stomach, and this is one of the reasons why if people take too much of the ibuprofen or naproxen or any NSAID, you can start to get gastrointestinal bleeding, which is ulcerations, because the hydrochloric acid starts to eat away at the tissue because of the decrease in the protective mucosal lining. Okay, also H. pylori, so the stomach acid kills Helicobacter pylori, also known as H. pylori. So people that are on proton pump inhibitors and antacids, and on top of the ibuprofen and all that, they drastically increase their chances for getting an H. pylori infection because you're taking away part of the immune system. And believe it or not, the stomach with all these juices are considered part of the immune system as well as the digestive system. Okay, earlier I talked about the pepsinogen being converted into pepsin, and you want to be able to take your proteins which get unraveled into a polypeptide chain and then eventually broken down into individual amino acids. If not, then you just get these partially digested proteins. So they're still not completely broken down. And if you're not careful, they can, these incomplete digestive proteins can pass into the small intestine and start to create some problems. Okay, the chief cells also secrete gastric lipase. So this is going to help you break down your fats. Okay, so lipid, fat, ACE enzyme, so it helps break down fats. Okay, intrinsic factor released by the parietal cells is going to help you with the absorption of vitamin B12. Okay, without vitamin B12, hemoglobin cannot be synthesized and anemia can develop. Okay, so B12 actually does go directly to the bone marrow stem cells. Okay, the parietal potential stem cells to help with this blood forming process. Okay, if you're going to take vitamin B12, so injection or oral, you want to make sure it is methylcobalamin. Okay, this is good. Cyanocobalamin is bad. Okay, so read your supplements or any form of vitamin B12 that you're taking. If it says cyanocobalamin, that is not good. It is literally cyanide and human feces. Okay, so you can look it up for yourselves. Nobody believes me. But once you look it up and type in is cyanocobalamin made from cyanide and human feces, and you will find the answer is yes. Okay, so your energy drinks often have cyanocobalamin. So just make sure you read your labels. And one thing that I teach my patients is you want to try to stay away from sugar. Some of these energy drinks have just so much sugar in them, 40 grams of sugar and ridiculous numbers like that. And they also have cyanocobalamin. You want to make sure that it's methylated, so take the best form of injection or oral or energy drink is the methylcobalamin. Going back to that gut-brain axiom, or the gut is a second brain. So the book, surprisingly, calls the digestive tract and the central nervous system the gut-brain peptides. Okay, this includes substance P, vasoactive intestinal peptide, secretin, gastric inhibitory peptide, cholecystokinin, neuropeptide Y, and there's over 20 different hormones that are found with the gastric and pyloric glands, part of the enteroendocrine cells that produce as many as 20 different hormones. So as far as your brain chemistry, it is so important that your stomach chemistry be as good as possible, because the health of the stomach does dictate the health of the brain. Okay, so the mucus protects from hydrochloric acid. Hydrochloric acid activates pepsin, helps unravel dietary proteins, helps kill pathogens such as H. pylori. Intrinsic factor helps the absorption of vitamin B12. Make sure it's methylcobalamin. Chief cells secrete the pepsinogen and gastric lipase. And then the enteroendocrine cells, so gastrins, serotonin, a lot of serotonin is actually manufactured in the gut. Okay, some authors claim it's as high as 90% of your serotonin is manufactured in the gut. Okay, and serotonin is that mood hormone. Okay, so another thing that I work with clinically are people with anxiety, depression, ADD, ADHD, and other behavioral disorders. And one of the ways that we help balance things and improve things is balancing out the stomach, their gastrointestinal system. I'm telling you, every time we analyze a person with depression and all that, 100% of the time it comes back that they're consuming foods that they're allergic to, and we determine that through the labs, the food allergy and sensitivity testing, and then also discover that they're also consuming man-made and synthetic and artificial so-called foods, such as food coloring, additives, preservatives, food that's been doused with glyphosates, and so on. Okay, so turning over this new leaf of being careful of what kind of chemistry that you put in your body and the way that that chemistry or food interacts with the chemistry in your stomach is very important. Okay, also important for brain health. Okay, the vomiting centers are located in the brain. So when the stomach detects through chemotaxis and these chemical irritants and bacterial toxins and anything that can activate the vomiting center that's actually located in the brainstem, then the body's going to send a signal to the stomach to throw it up. Okay, now that is a protective mechanism. Okay, it's designed to protect you from whatever this harmful thing is in your body. So as much as vomiting sucks, it is actually a good thing. Now, a person can cross a line by vomiting too much. It's too violent. You can tear stuff. It's called a Mallory-Weiss tear. If you are vomiting too hard and you tear the esophagus and you're going to get all this bleeding. Okay, and too much vomiting can also create dehydration and a whole host of other problems. So up to a point, vomiting is necessary to get rid of the harmful substance that's in your body. But then it can cross a line where a person will need medical intervention, okay, such as dehydration, fluid and electrolyte, and acid-base imbalances. All right, the GI system does have these tight junctions, and these tight junctions are really important. In fact, they're held together by a protein called a zonulin, okay, zonulin and desmosomes. All right, so you want the tissue to be very tight. You don't want any gaps or spaces. Okay, as soon as you get a space, which would be here, then you create what's called leaky gut. Okay, now the tight junction is broken and the food and chemistry and toxins and artificial stuff that people eat seep out of the lumen of the digestive system and into the bloodstream because of that broken tight junction. You can actually test for this. If you're ripping apart this tissue, you're going to release these zonulins, which is a protein, into the bloodstream. So if you test somebody for zonulins and you find them, then they have what's called leaky gut. Okay. Plus, it'll accompany signs and symptoms of gut inflammation, and my stomach hurts, and nausea, vomiting, and on it goes. Okay. So there's usually a correlation there with an upset tummy, and there's a million ways that can look. Start doing labs, find the zonulins. Then the treatment is to reduce gut inflammation, and then the body, which is a self-healing organism, will heal itself. Okay, and then if you want, you can do a post-lab to see if you still see any zonulins in the bloodstream. Okay, plus there are signs and symptoms of improvement and all that. Okay, epithelial cell replacement. So the stomach's epithelial cells live only 3 to 6 days and then are sloughed off into the chyme and digested with food, but they are also replaced rapidly. Okay, so all the different cells in our body, so bone replaces itself, the liver, the stomach, the heart, your skin, red blood cells, live 120 days. So all the cells in our body have a lifespan. All right, so the stomach epithelial cells is only about 3 to 6 days. All right, here's a example of the chyme. Okay, and then there's that pyloric sphincter area. So right now the pyloric sphincter is closed, and then here it is open, allowing a little bit of that chyme to enter into the duodenum. Okay, the cephalic phase with digestion and eating and all that is the stage where the stomach responds to the mere sight, smell, taste, or thought of food. Okay, this is an autonomic reflex. So if you're hungry and you see food and smell it, your stomach juices start going, you start to salivate. Okay, that's the cephalic phase. The gastric phase is the part which you're actually swallowing the food. And you have, once it enters into the stomach, you have active gastric secretion. Okay, gastric secretion is stimulated by acetylcholine, histamines, and gastrin. All right, acetylcholine released by the parasympathetic nervous system, histamines by the paracrine secretion from the enteroendocrine cells, and then gastrin produced by the G cells. Okay, the three of these cause the parietal cells to secrete hydrochloric acid and intrinsic factor, along with the pepsinogen. Protein is broken down into amino acids. pH drops. In the intestinal phase, this is where chyme starts to arrive in the duodenum. Okay, the pyloric sphincter gradually introduces the chyme. Okay, cholecystokinin is released. One thing that will help do is stimulate the pancreas and the gallbladder to release their pancreatic juices, and the gallbladder to release its bile that is stored. And bile helps you emulsify fats. Okay, so it brings fat and an aqueous environment and brings them together to help with the breakdown.